My name is Darren Kies. I'm an interventional radiologist. I'm the chief of interventional radiology for a private practice group called Piedmont South Imaging, and we provide services to Piedmont Fayette Hospital and Piedmont Noonan Hospital in the south and southwest metropolitan area of Atlanta. So low dose screening for lung cancer is recommended by the United States Preventative Task Force Service. The recommendations have been updated yearly, and they change a little bit based on your age and smoking pack years. But the current recommendations is that all adults between the age of 50 and 80 years of age who have at least a 20 pack year smoke history should receive yearly low dose screening. And that 20 pack year history includes current smokers or people who were former smokers with a 20 pack year history, but quit, basically haven't quit more than 15 years ago. So, pack years refers to if you smoke a pack a day, and you smoke for a whole year, that's considered one pack year. If you're a 2 pack a day smoker daily, that's considered, and you do that for a year, that's considered 2 pack years. So a 20 pack year history is someone who smoked a pack of cigarettes a day for at least 20 years, or 2 packs of cigarettes every day for at least 10 years. So that kind of helps put things into context. So, and this is low dose CT screening. This is a special kind of CT scan. It's not diagnostic, and it's not designed to pick up every little thing in your chest and upper abdomen. It's mainly just screening the lung fields to look for nodules. But it's very effective at detecting lung cancers early. And it's very important to understand that a early stage 1 lung cancer is a very treatable form of lung cancer, whereas lung cancer that has spread to lymph nodes or has spread outside the lung to other parts of the body is a very untreatable form of cancer. Hence the rationale for getting this examination done. Once you get in this screening protocol, ideally in a perfect world, you continue getting screened at the same place. It's very important to have prior imaging available. So, if you find a place that you like, it's always better to kind of keep going to that place if you can. Nonetheless, there are ways that, your physician can get older studies for comparison purposes. But once you get on that train, again, between the years of 50 and 80, those are the prime screening years. Now, if you quit smoking, say you're a current smoker and you've been doing this for about 3 years and then you quit smoking. Once you've quit smoking for 15 years during that age range of 50 to 80, you can actually stop your screening once you hit that 15-year mark. Furthermore, obviously, once you get to 80 years old, you don't need to be screened anymore. The other thing that would kind of stop you from needing these screening examinations is, well, one, if you get diagnosed with lung cancer, that kind of takes you out of the screening pool. Once you have a lung cancer, you're no longer being screened for lung cancer, you're being treated. And that's a whole different algorithm. And then 2, if unfortunately, you were to develop some kind of medical condition during that screening period that would prevent you from, getting or requiring or being able to tolerate the standard treatment for a lung cancer, then you don't necessarily need to be screened for it. To put it in other terms, if say, unfortunately, a patient developed a stroke and they were very debilitated by it and bedbound, and they weren't likely to survive a lung cancer surgery or be able to to get through a chemotherapy regimen, well, there's really no rationale then to screen them for lung cancer. So again, once you reach 80, or if you reach some type of medical condition where you can't, where you can't be treated for your lung cancer, those are reasons why you could stop screening. But otherwise, when you're in that age range, if you're, current or former smoker with that 20 pack year history and you've been smoking within the last 15 years, you should continue to get your lung cancer screening yearly.